Okay, so good day. Let's start. I'm Dr. Kieffer Ferraris. I'm one of the pediatric urgent care specialists and pediatric infectious disease specialists here in CMI. So if everyone can hear me, let us start. So in the next 25 to 30 minutes, I'll give a brief overview of the clinical and medical aspects of the animal bite primary care protocols of CMI based on the frequently asked questions of our patients and parents of our patients. This lecture is recorded and is streamed live in FB. I have no conflicts of interest to declare, and I will be mentioning some rabies vaccine brands. And but I'm not paid or sponsored to mention these vaccine brands. Okay. So why are we doing this? No? Why is the country doing this? Not just CMI. The context is, firstly, last year, 2024, from January to around September, there has been an increase in rabies cases and a rapid increase at that compared to the same time period the other year, last 2023. And Metro Manila is one of the top regions with the most number of cases. There was also an increase in the awareness about rabies when a certain 13-year-old teenager from Condo district in Manila, and here mentioned in a letter to the Lancet editor, she documented her last few hours before she died of rabies. No, she shared her experience of symptoms, no, before dying of it, and she hoped that her testimony will raise awareness about rabies and its dangers. So rabies is an almost uniformly fatal encephalitis, which is an infection or inflammation of the brain. So after a bite, the rabies virus travels through the nerves into the brain and causes inflammation. And once with symptoms, there really is no cure. And hence, the prophylaxis and the preventive measures and even the vaccination are really the best courses of action to prevent these. So CMI has now ventured on rabies pre-exposure prophylaxis mainly, but also on post-exposure prophylaxis or PEP. In the context of rabies prevention, pre-exposure prophylaxis or PrEP, when you hear the doctors saying these, no, when they hear you, when you hear them mentioning these, it refers to administering a rabies vaccine before an exposure or before a bite. No, it might be a bite, it could be a scratch or a lick. And economically, when you are given pre-exposure prophylaxis and you got bitten even years after the total number of doses, um, even years after, the number of doses for post-exposure prophylaxis will be reduced, and hence costs will also be reduced. So this program is also in line with the clinical practice guidelines of the 2018 Philippine Society for Microbiology and Infectious Diseases. This is the Society for the Adult Infectious Disease Doctors, wherein pre-exposure prophylaxis or rabies vaccine before a bite is recommended not just for the usual at-risk groups, quote unquote, but also pet owners, households with pets, no, even all the household members, and even children aged 5 to 14 years old living in areas where there are high cases of rabies encephalitis. And more so, the Philippine Pediatric Society, the Pediatric Infectious Disease Society of the Philippines, and the Philippine Foundation for Vaccination have now recommended that the rabies vaccine should now, as a pre-exposure prophylaxis, should now be routinely given to children 2 to 10 years old especially. So when we say routine, this is like standard already, bordering to required. No? In the same way that we doctors should routinely give vaccines for flu, for tetanus, for diphtheria, whooping cough, and the like. This is in contrast to the previous years when the rabies vaccine, as pre-exposure prophylaxis or before the bite, was recommended for special groups and special populations only years before. Okay? So the CMI last year has launched the Animal Bite Primary Care Program, no, especially for pet owners, for fur parents, no, and for children. And this has been incorporated mainly into our urgent primary care consults. So overall, this CMI program will not just be limited to post-exposure prophylaxis or pre-exposure prophylaxis, nor to the rabies vaccination itself, although that is the bulk of the program. So this CMI program entails also the medical advice that we give, the anticipatory guidance, the management before and after exposure, and it will also entail local wound care, antibiotic prophylaxis or prescription, and also anti-tetanus vaccines. For those availing the rabies vaccine, there is really not much difference from other vaccines on the way we do it. So it will be given in the shoulder muscle for 2 years old and above, or in the thigh for less than 2 years old, or for very thin children. We do not inject in the butt because of unpredictable absorption. Actually, the vaccine can also be given intradermally or under the skin, like a skin test, but the doctor has to be very good and trained on how to do the intradermal injection. So in the meantime, so it's easier for everybody, we do intramuscular or we inject deep into the muscle. So this is the basic schedule for the rabies vaccine used as pre-exposure prophylaxis, meaning before the bite. This is different from the schedule of rabies vaccine after a bite, which you may be more familiar with. So, with a WHO pre-qualified vaccine such as Verorab, meaning the vaccine brand that is already studied and endorsed by the WHO, the schedule is one dose each on days 0 and 7. So, two doses at least 1 week apart. On the other hand, non-pre-qualified vaccines such as SPIDA, no, are vaccines that, although they are not yet endorsed by WHO, they have already been studied by the and endorsed by the local country's FDA. So here, for the non-pre-qualified vaccines, we also give a third dose on day 21 or 28. And if your doctor deems that your immune system is low or lacking or compromised because of an illness or medication, such as chemotherapy, we also give the third dose, regardless of the brand. Now, what if I miss a dose? In the new guidelines, 2018 onwards, there is no need to restart the series or the vaccination. So this is because the vaccine is highly immunogenic, meaning it can rapidly produce again an antibody or the antibodies when the second or third dose is given. Now we receive some referrals or questions from parents. Do I need boosters for pre-exposure prophylaxis? So generally, no. That is why vaccination of pets is also important. Here in the Philippines, though, we give periodic or routine boosters only if you have an occupation, such as you're a healthcare worker handling rabies patients, you're like a mortician, or you're a veterinarian, or if you have a recreation or a hobby, such as spelunking, that puts you at continuous or frequent risk of exposure to rabies. But for the general population, like us, no, we do not give boosters unless we are already bitten, meaning for post-exposure prophylaxis already. And this is one of the main advantages of giving rabies vaccine before the exposure or before a bite. Because if you are already vaccinated and you are bitten, even years from now, you will be given only two booster doses and not the full course regimen of 4 to 5 doses. And the rabies immunoglobulin or the rabies antibodies are also not given to you. So it's much cheaper for you in the long run and it's more cost effective. Post-exposure prophylaxis, on the other hand, by the name itself, refers to the management after a rabies-prone exposure. So it includes not just the vaccine or the immunoglobulin or the antibody, but also local wound care. So you want to give everything, as much as possible. So The rabies vaccine is given so that the immune system can later on produce antibodies. But the thing is, the antibodies reach the detectable levels or high levels at least a week after from the first dose. But if you have a bite, no, you have a bite, you want to have antibody levels that are already high on the first day instead. That is why we give also rabies immunoglobulin on top of rabies vaccine. But it's not yet available. The rabies immunoglobulin is not yet available here in CMI, but we have the Verorab or the rabies vaccine. So, as much as possible, the initiation of rabies vaccine must not be delayed for any reason, regardless if it has been weeks or months or years after a bite, because the symptoms of rabies may come like 1 to 3 months after in average, and in some cases, it could be a year after. There are case reports wherein there could be symptoms 5 to 7 years after. So it's never too late for a rabies vaccine until you have the symptoms already. So once the symptoms are there, we do not give the vaccine anymore or the immunoglobulin because they are not effective anymore. Also, although not in the purview of post-exposure prophylaxis itself, here in CMI, the holistic post-exposure management and the urgent care consult will also include antibiotic prescription and or tetanus prophylaxis. So how do we take care of the wound? So this is an equally important component of post-exposure or post-bite management aside from immunization. So hence, this must not be forgone when managing animal bites. So for example, this is the first aid that you'll do at home in your homes. So after exposure, immediately and vigorously wash and flush with soap and water for at least 10 minutes. You can use also iodine, alcohol, chlorhexidine, or any disinfectant. If you have to wash an open wound as much as possible, use gloves, mask ideally, and some goggles if there could be some splashing. There are some cases, though, that, for example, if it's a large wound, a deep facial bite, um, the wound keeps on bleeding, and you have to suture. You have you might notice that your doctor might delay the suturing for more than 2 hours, no? Because if you have to suture again, you might be inoculating the virus deep into the wound. So we delay first, we give the antibodies first, no, before doing the suturing. Also, you have to avoid any ointment, cream, or in some Philippine folk medicine, they have to rub garlic. No, it's not recommended anymore because they could further promote bacterial growth and do some secondary infection to the wounds. So there are also some questions we received from parents or from our patients. No, which bites do we need rabies immunization? So of course, dogs, cats, and ferrets, yes. No? Bats, they are considered rabid unless proven otherwise. That's why if you're a spelunker, if you're doing cave explorations and you're exposed to bats, ideally you need to have some rabies vaccines also. And livestock, yes. And this is a common question also. How about rat bites or bites from mice? Generally, we don't need rabies vaccine. We give instead some antibiotics or some anti-tetanus prophylaxis and vaccines also. So just sharing how we doctors decide which ones do we give vaccines to, which ones do we give the immunoglobulin or the antibodies to. So first we categorize. So if it's cat if it's category one, meaning you just touched or fed an animal, your intact skin was licked, or you were exposed to the shared utensils or cups, but it was washed in between. It's just a casual contact to a rabies patient. There's no vaccine. There's no vaccine given. There's no immunoglobulin or the RIG given also. So instead, we consider pre-exposure prophylaxis. However, if there's already a wound, a scratch, or a bite, but there's no spontaneous bleeding, or it was induced to bleed, or there was no wound, but in the site of the bite or the nibbling, there was development of a bruise, It's just category 2. We just give the vaccine, but not the immunoglobulin or the antibodies. However, if you're an immunocompromised person, like you're ongoing chemotherapy, you're on chronic steroids, we also give the antibodies to help the immune system boost the levels of the antibodies. On the other hand, if the wound is already spontaneously bleeding, it's a puncture, it's an avulsion or a laceration, if it's a bite or a scratch from a bat, no? If the patient is really rabid, um, your mucous membranes will lick, no? For example, sometimes the rabid dog will kiss you or lick you in your mouth or your tongue, no? And if there were licks on broken skin, it's considered category 3, and you must be given both the vaccine and the immunoglobulin. Okay? Here, I want to emphasize that if it's just a category 2 wound, no, just a minor scratch, no bleeding, but if it's in the head or in the neck, it's considered category 3 because it's near the brain already. No? And also, I want to point out that all bat exposures, so especially with spelunkers, cave explorers, or those who, upon waking up, they notice in their room or tent that there's a bat flying around and they cannot recall or cannot reliably remember if they were bitten, especially because bat bites are really small. We consider those as category 3. We give the rabies vaccine and the immunoglobulin. So the table is not exhaustive. There's still plenty of scenarios that are referred to us that are not here. I want to emphasize here also that if the patient bitten has a complete or an adequate pre-exposure prophylaxis, meaning he was already given adequate vaccines, rabies vaccines before the bite. Once bitten, we do not give the rabies immunoglobulin anymore. So that's the advantage also of giving vaccine preemptively before a bite. So here in CMI, it's available. So, and this is how we give the rabies vaccine after a bite. No? So if you are not yet vaccinated beforehand, there are other WHO endorsed or DOH endorsed schedules, but this is the one most commonly used. So for the WHO pre-qualified vaccines such as Verorab, there are 4 doses given on day 0, 3, 7, and 14. But for a WHO non-pre-qualified vaccine such as SPIDA, we give a 5th dose, especially if the animal is rabid, killed, died, or unavailable for a 2-week observation period, or if confirmed already to have rabies. So we give the 5th dose, no, the day 28 or 30. And again, the advantage if you were vaccinated previously or even before the bite is that you will be given 2 doses only on days 0 and day 3. No? Moreover, there are no absolute contraindications to post-exposure prophylaxis. So even if you are pregnant, even if you were a newborn, you were just born yesterday, you're an infant, if you were bitten, we still give the rabies vaccine, no? Because the benefits far, far, far outweigh the risks. And like in pre-exposure prophylaxis, we do not restart the series anymore if there is a delay in the dose. Your doctor might also have to give some antibiotics, especially if the wound is frankly infected. If it's a cat bite, you were bitten by a cat, where 80% of the time the cat bite gets infected. If you're immunocompromised, if there's a suspicion of bone involvement, if it's really deep, sometimes we give antibiotics, and it depends on the mechanism of injury and the patient factors. If we give it for 3 days, or we can go if we can give as long as 5 to 7 days. There are also some questions. What if the consult happened weeks after? So it depends on the status of the biting animal. We should treat you as if the exposure or the bite had occurred recently, unless the animal involved has remained healthy until 14 days after the bite. If it's still healthy, if it's still alive after 14 days, sometimes we do not give any more the rabies vaccine. Can we change the route of administration? Like for example, from under the skin. For example, if you're in Boracay, where the local health center gives the rabies vaccines intradermally or under the skin, and you transfer here to CMI where we give it intramuscularly into the muscle. Is it okay? Yes, it's okay. And there's no need to restart. We just continue according to the schedule of the new rep. Can we change brands? Yes, it is acceptable. No need to restart, but we have to continue according to the previous schedule. So, for example, if you were given Spida at first, which is 5 doses, and you transfer here in CMI, we give Verorap, we still have to give the fifth dose, unless the biting dog or biting animal is still alive. Okay? This is also a common question by parents. No? Can the rabies vaccine be given with other vaccines? No? Yes, especially for children. Let's say you have to give also flu vaccine, or the kid is due for boosters for tetanus, whooping cough, and the like. We can give. We can give. But in some cases, if the patient has to be given immunoglobulin or antibodies, there may be cases where the measles or chickenpox vaccines might have to be delayed for like 4 hours. Sorry, for 4 months. So they may have to be delayed for 4 months. There are also questions now, what if the dog or the cat was vaccinated naman, no? So if category one, just a lick, just touch, we just observe. If it's category two, minor abrasions like scratches without bleeding, no, we may delay the vaccine for like two weeks only if all of the following are met. No, the animal is healthy and observable. The animal must be 18 months old, so 1.5 years old. And the animal must be vaccinated within the past 12 months and with no missed doses. Otherwise, if these are not met, you have to give the vaccine. So we give the rabies immunization if it's category three, meaning there's spontaneous bleeding and the like. It's the animal has signs and symptoms of rabies, and if the animal is involved in multiple bites for the last 24 hours. There's also the question, if not the biting animal, what if you yourself was previously given rabies vaccines? For example, like a month ago, you were just given some rabies vaccine. What we do is we assess if it's adequate, and if it's adequate, we assess the level of risk. No? We consider it adequate if you completed the post-exposure or pre-exposure prophylaxis, or if you have had at least 2 doses or 3 doses, depending on the brand of the rabies vaccine. Okay? So once we consider this adequate or complete, this is our criteria. If the last dose was given within the past 3 months, if the animal is healthy, it's the same animal that bit you before, the biting animal is previously immunized, or if it's just in the arms or legs, no, we can observe. No? We can observe for 14 days. And if after 14 days the animal is healthy, no need to give the rabies vaccine. However, if it has if it was more than 3 months already, and if it's any of the following, the biting animal cannot be observed, it was a stray dog or a stray cat, the site of the bite is in the fingers or toes or in the neck or head, and there are multiple deep bites, we give the boosters 2 doses, at least 3 days apart. And generally, we give the full PP if there's no evidence that you were given beforehand, if it was incomplete, if you're immunocompromised, or if you were bitten by a bat. Okay? And all animal bites are considered tetanus-prone wounds. So if you have an unknown number of tetanus-containing vaccines, if it's just less than 3, if you can't remember, we also give boosters for tetanus. So how do we prevent this? You have to understand that most dog bites are directed towards children because they are small, they're easy to bite. So most dog bites are generally from the family pet rather than the strange dog on the street, unless you're in old Manila or in the suburbs or rural areas. So important to remember that any breed of dog can bite, and even friendly dogs can bite. No? Because biting is part of the animal's or your pet's communication toolbox. So the reasons a dog might bite may be because they are scared, they're startled, or they need space. or they are guarding a resource like food when they are eating, or if they are in pain. So you have to review with your veterinarian, with their other fur parents, regarding the your animal's body language. You know, for angry dogs might lunge, might growl, they might bare their teeth, and angry cats will take the arch their backs, their hair standing on end. They might vocalize weird sounds, or their pupils might be constricted into slits. So you have to be familiar with that, and you also have to teach your kids on recognizing those body language warning signs. And you have to teach your kids also that if they want to approach or pet a dog or a cat, they have to ask the owner first. And for kids, if kids you're listening here, or if for parents who have kids, um, tell your kids, or for kids, tell your parents that once, if you're bitten, tell your parents immediately that you were bitten, and please, parents, don't get angry to these kids, they're innocent. And lastly, don't punish the dog or your cat if they're giving warning signs, because it's part of their communication toolbox. Okay? So any clarifications, questions, or comments? So if none, you can just message CMI if you have any questions. Or you can just email us if you have any questions or clarification. So this lecture will also be available soon via our social media accounts. Thank you very much.